Welcome everyone. Myself Partho Das, fourth year student of Lakhimpur College of Veterinary Science. Now I am going to give you a presentation on the topic of Parvo virus infection in dog. So the contents of this Part 1 presentation are introduction, etiology, mode of transmission, clinical findings, diagnosis, treatment and control. So let's start the presentation. Introduction. The canine parvovirus infection is a highly contagious viral disease that affects dogs. The virus manifests itself in two different forms: intestinal form, which is characterized by vomiting, diarrhea, weight loss and lack of appetite, and second one is cardiac form, which affects the heart muscle of very young puppies, often leading to death. The first canine parvovirus infection was observed in USA 1978. In India, the disease was first recorded in Tamil Nadu 1981. The majority of cases seen in unvaccinated or incomplete vaccinated puppies of ages 6 weeks to 6 months. Sometimes adult dogs are also get infected. Certain dog breeds such as Rottweiler, Doberman, Labrador Retriever, German Shepherd, Pitbull, Spaniels are more vulnerable to this disease. Mortality rate is about 85 to 90% in untreated cases. So next, coming to the etiology. The causative agent of this disease condition is canine parvovirus, CPV. It is the smallest known DNA virus, size of about 18 to 24 nanometer in diameter. There are two types: canine parvovirus type 1 and canine parvovirus type 2. Canine parvovirus type 2 is more common in recent times. This virus has got close antigenic relationship with feline panleukopenia virus, having 98% identical in DNA. This virus is resistant to ether, chloroform and stable at pH 3 and pH 9. It can withstand high temperature and remain viable in fomites from months to year. However, the virus can be destroyed by 2% formalin, 2% sodium hydroxide and 2% sodium hypochlorite. Next, coming to mode of transmission. It can be spread by direct contact with an infected dog or indirectly by the fecal-oral or nasal route. Large number of viruses are found in an infected dog stool, so when a healthy dog sniffs an infected dog stool, it will contract the disease. The virus excretion from the infected dogs occur from 2 to 8 days for 8 days following infection. Next, coming to the pathogenesis. Ingestion or inhalation of the virus. Then viral application occurs initially in the lymphoid tissue of the oropharynx. Then virus spread via bloodstream to lymph nodes, bone marrow, intestine and cardiac muscle. Then it infects and destroys rapidly dividing cells of small intestinal crypt, epithelium, lymphopoietic tissue and bone marrow, which results viremia, intestinal disturbances and rarely cardiac signs. Lymphopenia and neutropenia may develop. Death may occur due to shock, septic shock and circulatory failure. Next, coming to the clinical findings. Clinical findings generally develop within 5 to 7 days of infection, but can ranges from 2 to 14 days. There are two forms of parvovirus. The first one is parvovirus enteritis or intestinal forms. Symptoms of these forms are: there is high rise of temperature in the initial stage of the disease, but gradually turn to subnormal with the advancement of the infection. Next, there will be severe vomiting, inappetence, severe weight loss, tachycardia, prolonged capillary refill time, frothy yellow color vomitus, restlessness. There is brownish There will be brownish semi-solid feces followed by fetid hemorrhagic diarrhea. There will be severe dehydration. And the symptoms of parvovirus myocarditis or cardiac forms are: puppies under 10 weeks of age usually suffer from this form. Symptoms may or may not exist. Heart muscles are damaged, show signs of circulatory failure, respiratory problems. Animals die due to cardiogenic shock. Next, coming to diagnosis part. From the history of vaccination of pup and their parents, from the clinical signs and symptoms, and hypothermia, leukopenia, leukocytosis, tachycardia, and tachypnea. For confirmatory diagnosis, animal inoculation test, serum neutralization test, isolation of viral antigen, heme agglutination test, heme agglutination inhibition test, fluorescent antibody test, and ELISA. Hematology, there will be leukopenia, granulocytopenia, PEG cell volume will be decreased. And from abdominal radiograph, gas and fluid distension, contrast radiography may show corrugation in the intestine. ECG signs, there will be wave depression which indicate myocardial involvement. There will be a commercial diagnostic kit is available, represent Parvo AZ test. Treatment, there is no specific treatment, only symptomatic treatments are given. Fluids and electrolytes are given to restore the fluids and electrolyte loss. Broad spectrum antibiotic like ampicillin, chloramphenicol, erythromycin, gentamicin is given for 5 to 7 days. Whole blood transfusion is required against severe blood loss anemia. For persistent vomition, metoclopramide, brand name Reglan, given at the rate of 0.5 mg per kg body weight twice daily, or 1 to 2 mg per kg per day intravenously, or ondansetron at the dose rate of 0.5 mg per kg twice daily intravenously. To correct the gastric problem, H2 receptor blockers are given like cimetidine and ranitidine. Hemostat like botropase is given to stop the intestinal bleeding. Next, coming to the control part, strict hygienic measures are to be adopted in a kennel where outbreak has set in. Infected animals should be segregated from the healthy one and treated. All the excreta should be properly disposed and premises should be disinfected. The virus can be destroyed by 2% formalin, 2% sodium hydroxide, and 2% sodium hypochlorite. In the market, combined vaccine is available for parvovirus and brand names are Novivec DSPPIL, Canadian DSPPIL, Novivec Papi DP, Macavac P nasal. Next, coming to vaccination schedule, the first dose is given at 6 to 8 weeks of age, 1 ml subcutaneously, and second dose is given after 12 weeks, and sometimes third dose is also given after 16 weeks, and booster dose is given annually. These are references: a textbook of veterinary preventive medicine by Amlanti Chakrabarty, Mark Veterinary Manual, caninejournal.com, www.avma.org, prosudhanpahari.com, msdanimalhealth.co.in. Thank you.